Hello everyone. Our today's topic is about temporomandibular joint. The temporomandibular joint, it is a unique type of joint that combines the feature of both the gynecomastoidal and hinge joint. So remember, TMJ is an example of gynecomastoidal joint. Second, it is a hinge joint. So what do you mean by a gynecomastoidal joint? So it refers to the gliding aspect of the TMJ. This term allows for the sliding or the gliding movement between the articular disc and the condyle. This one is the condyle and the articular disc. This blue color refer to articular disc. So this gliding movement is important for the actions like side to side movement and protrusion, that is the forward movement of the lower jaw. Second is the hinge joint. It also acts as a hinge joint. So hinge joint means that involves the rotation of the condyle within the mandibular fossa. So rotation of condyle within the mandibular fossa. So this hinge joint, it is responsible for the actions like opening and closing the mouth, like when you chew or speak. So that is why TMJ, it is known as gynecomastoidal due to its ability to glide, and a hinge joint due to its ability to rotate. Now let us discuss the various parts of the TMJ. So what are the various parts of the TMJ joint? The TMJ joint, it consists of various parts. The parts are mandibular condyle. The parts are the mandibular condyle, temporal bone, the articulating disc, and the ligament. Now let us discuss them one by one. The first is the mandibular condyle. So it is a rounded protruding part of the lower jawbone that fits into the socket of skull. The second is the temporal bone. This one is the temporal bone. It is part of the skull and it has a socket known as glenoid fossa. Where the mandibular condyle, it articulates. It has an articular disc that contains a disc-like structure that is made up of fibrocartilage that separates the mandibular condyle from the temporal bone. So this blue segment will represents the articular disc. So a disc-like structure that is made up of fibrocartilage that separates the mandibular condyle from the temporal bone. So what is the function of this articular disc? It helps to cushion the joint and allow for a smooth movement. Now what are the parts of articular disc? It consists of anterior band, intermediate zone, and posterior band. So these are the parts of the articular disc. So the anterior part, it is the front part of the disc and it is attached to the joint capsule. So it helps to stabilize the disc within the joint. Other is the intermediate zone, that it is located between the anterior segment and this one is the posterior segment. So it is located in between. So it plays a role in absorption, distributing forces during jaw movement. The third is the posterior band. It is the back portion. The back portion of the disc is often thicker. So this portion is thicker and more fibrous. It is connected to retrodiscal lamina. So this one is the retrodiscal lamina or the retrodiscal pad. It is soft cushion-like structure that is located just behind the articular eminence. So this pad serves as a shock absorber and helps to distribute the forces within the joint. So that is important for maintaining the proper alignment of the articular disc and condyle during the jaw movement. So it has a superior lamina and the inferior lamina. The superior lamina, it is the upper layer of the retrodiscal pad. It is positioned above the articular disc. So it is positioned above the articular disc and act as a cushion and supporting structure. So the superior lamina, it contributes to overall function of the TMJ. It helps to stabilize the articular disc and prevent the excessive compression of the joint, whereas the inferior lamina, the lower part of the retrodiscal pad, it is situated just below the articular disc. The inferior lamina, it provides a cushioning and support to TMJ. So it prevents the excessive pressure of the joints. So helps to maintain the disc condyle relationship. So which part of the TMJ is avascular or devoid of the blood vessels? Remember, the articular disc within the temporomandibular joint is considered avascular, particularly in the central region. So the central portion of the articular disc, it lacks blood supply. So there is, remember, no blood supply in the central part of the articular disc. So this avascular part is known as the avascular zone of the articular disc. So the lack of the blood vessels in the central area of the disc would make it more prone to damage and slower to heal compared to the other part of the body. The peripheral part of the disc as well as the surrounding joint structure do receive a blood supply that aids in nourishment and healing. Other is the bilaminar zone. So remember, it is a double layer zone that is present at the back side. At the back side of the disc. So it consists of upper lamina and lower lamina, and it contains blood vessels and nerve endings. So this zone will contribute to nutrition and sensory feedback of the disc. So what is the function of the, let us discuss the function of the articular disc. So what is the function of this articular disc? So the articular disc in its resting position, the articular disc, it will be located behind the mandibular condyle and the mandibular fossa. So in the resting position, the articular disc, it is located between the mandibular condyle and the mandibular fossa. So it will act as a cushion and separate these two components, that is the condyle from the mandibular fossa. So when you start to open your mouth, the mandibular condyle, this mandibular condyle and the articular disc, they would move forward and slightly downward. So together within the mandibular fossa. So that allows the jaw to hang open. So if you need to move your lower jaw forward as in protruding motion, the articular disc will glide along the mandibular fossa, along this motion. So that will allow the disc, the disc will allow the condyles to smoothly move forward. So when you close your mouth, the articular disc would move back along with the condyle, returning to its original position, that is between the condyle and the fossa. When you move side to side movement during chewing, the articular disc, it will shift to accommodate these actions. So that is the condyle will move smoothly within the fossa while maintaining the cushioning effect. So remember, the articular surface of the temporal bone, it is situated on the inferior aspect of temporal squama anterior to the tympanic plate. Now let us discuss about the capsule of the temporomandibular joint. The capsule of the temporomandibular joint, it refers to the capsule, it refers to the fibrous structure that surrounds the joint. So the capsule, what is the function of capsule? It will provide the structural support and stability to the TMJ. So it helps to hold the joint components together and preventing dislocation or excessive movement. The inner surface of capsule, it is lined with synovial membrane. So it has a synovial fluid that will lubricate the joint and will nourish the articular cartilage within the joint. So the dysfunction or the inflammation of the TMJ capsule, it can lead to various TMJ disorders that can lead to pain and restricted jaw movements. Now let us discuss what is articular eminence. The articular eminence, so it is a bony structure in the skull that is so the articular eminence, it is a bony structure in the skull that is a part of TMJ anatomy. The articular eminence, where it is located on the temporal bone, just in the front of the external auditory meatus. So it has a curved convex shape and it forms a portion of TMJ socket along with the mandibular fossa. So remember, the articular eminence and mandibular fossa together create a socket where the mandible condyle articulates. The articular eminence, it plays a crucial role in TMJ functioning. So when you open your mouth, the mandible condyle moves along with the articular eminence and into the mandibular fossa. So that motion allows for the hinge-like action of the jaw as it opens and closes. Apart from that, there is articular tubercle. So it is a bony prominence or bump that is located on the temporal bone. That is the part of skull. Its position is just in the front and slightly above the articular eminence. Now let us discuss, we discussed about articular disc. The articular disc is the most important component of TMJ is the articular disc. It is biconcave fibrocartilaginous structure between mandibular condyle and temporal bone component of the joint. So it has a curved lens-like shape with both of its surface being curved outwards like two sides of the lens. So the disc, remember, it is primarily composed of fibrocartilage. So that make it durable and capable to withstand the forces and stress in the jaw movement. So during the movement, like opening and closing of the jaw, this disc will act as a hinge that will allow the mandibular condyle to pivot within the TMJ, simple to a hinge on a door. In addition to the hinging, the disc also do gliding movement. So when you need to move your jaw forward, as in the protruding, the disc glides along with the curved surface of the joint. As mentioned earlier, the articular disc, it consists of three parts. What are those? Anterior band. The anterior band is in the front of disc. It is about 2 mm in thickness and it is attached to the capsule part. The posterior band is it is more thicker, that is 3 mm, and connect to the retrodiscal tissue. Whereas the intermediate band is of 1 mm in thickness. It is thinner and helps to play a role in absorbing and distribution forces during the jaw movement. Now let us discuss the fibrous capsule. So remember, this fibrous capsule, it is made up of dense connective tissue and it provides support and stability. So its main function is to provide support plus stability. Sometimes the TMJ capsule, it is in the anterior part of the capsule, but you will see there is small opening. So this opening will allow the passage of the tendon of the lateral pterygoid muscle. So the presence of this orifice in the capsule, it creates an area of weakness in the joint capsule. Now let us discuss the various ligaments. What are the ligaments of the TMJ? Temporomandibular ligaments. The first is the sphenomandibular ligament. So the sphenomandibular ligament, it originates from spine of sphenoid bone. Sphenoid bone. And it is inserted into the lingula of the mandible, that is present on the inner surface of the mandibular ramus. This ligament will help to limit the excess movement of the mandible, and it contributes to the stability of TMJ. Other ligament is stylomandibular ligament. The stylomandibular ligament, it originates from the styloid process of the styloid process of the temporal bone, and it is inserted into where? Angle of mandible. So the stylomandibular ligament, it helps in limiting the excessive protrusive movement of mandible. Other is the lateral ligament. So it originates from the zygomatic process of the temporal bone, and it is inserted into the neck of the mandible.